One of the following glands that regulates calcium metabolism is A. Parathyroid gland, B. Thyroid gland, C. Adrenal gland, D. Thymus gland. And the correct answer is A. Parathyroid gland. Parathyroid hormone regulates calcium levels in the blood largely by increasing the levels when they are too low. It does this through its actions on the kidneys, bones, and intestine. All of the following features are true related to kidney except A. Bean-shaped organ, B. Maintains acid-base balance, C. The organ that stores urine, D. Its functional unit is the nephron. And the correct answer is C. The organ that stores urine. The urine is stored in the bladder until it leaves the body through the urethra. Shoulder blades, skull, sternum and ribs are made up of A. Short bones, B. Sesamoid bones, C. Irregular bones, D. Flat bones. And the correct answer is D. Flat bones. Flat bones are bones whose principal function is either extensive protection or the provision of broad surfaces for muscular attachment. These bones are expanded into broad, flat plates as in the cranium, the ilium, sternum and the ribcage. All of the following are psychological tests except A. Intelligence test, B. Aptitude test, C. Test of physical maturity, D. Personality test. And the correct answer is C. Test of physical maturity. The major types of psychological tests are personality tests, achievement tests, attitude tests, aptitude tests, emotional intelligence tests, intelligence tests, neuropsychological tests, projective tests, and observation tests. All of the following are negative experiences of hospitalization except A. Pain, B. Death, C. Complex environment, D. Assurance and attention. And the correct answer is D. Assurance and attention. Pain, death and complex environment are all negatives which a patient experiences during his hospitalization. On the other hand, assurance and attention are positive experiences for a patient during his hospital stay. Physical changes in adults and girls include all of the following except A. Attainment of menarche, B. Breast development, C. Beard growth, D. Growth of pubic hair. And the correct answer is C. Beard growth. Beard growth is seen in adults and boys and not in adults and girls. Which of the following bed is useful for preventing bed sores for bedridden patient? A. Fracture bed, B. Open bed, C. Occupied bed, D. Water mattress bed. And the correct answer is D. Water mattress bed. Water mattress beds are excellent in the prevention of bed sores. When a patient is bedridden for an extended period, a water mattress bed is often used to prevent bed sores. Water displacement causes a state of weightlessness, thus reducing pressure on the skin. How much salt must be added in 1 liter of water to make a solution of 0.9% normal saline? A. 19 grams, B. 18 grams, C. 9 grams, D. 90 grams. And the correct answer is C. 9 grams. Create a saline solution by adding the correct amount of pure non-ionized sodium chloride to the water to make one of two solutions isotonic. This is a 0.9% saline solution or 9 grams of sodium chloride dissolved in 1 liter of water. If a patient's blood pressure is 150 by 96 mm of Hg, his pulse pressure is A. 54, B. 96, C. 150, D. 246. And the correct answer is A. 54. The top number minus the bottom number, that is the systolic minus diastolic, will give you the pulse pressure of the patient. Process of sterilization of articles and instruments by steam under pressure is called A. Hot air oven, B. Autoclaving, C. Fumigation, D. Hot water dip. And the correct answer is B. Autoclaving. Autoclaving is the most effective method of sterilizing the lab equipment, especially for liquid handling products, to kill harmful bacteria, viruses, fungi, and spores. The autoclaving process takes advantage of the phenomenon that the boiling point of water or steam increases when it is under high pressure. Glycerin enema is an example of A. Astringent enema, B. Purgative enema, C. Emollient enema, D. Retention enema. And the correct answer is B. Purgative enema. Upon rectal administration, glycerin enema creates an osmotic gradient, thereby attracting water into the rectum. This increases volume, increases peristalsis, stimulates evacuation, and relieves constipation. Coronary artery disease is more common in which of the following? A. Hypotensive, smoker, diabetic, obese women. B. Hypotensive, smoker, diabetic, obese men. C. Hypertensive, smoker, obese men. D. Hypertensive, smoker, non-diabetic, obese women. And the correct answer is C. Hypertensive, smoker, obese men. Being hypertensive, being smoker, and obese men significantly increase the risk of coronary artery disease. A patient with lumbar surgery must be moved using the following technique. A. Log rolling technique. B. Technique with legs raised. C. Technique with head extended. D. Closer to side rails. And the correct answer is A. Log rolling technique. The purpose of log rolling is to maintain alignment of the spine while turning and moving the patient who has had spinal surgery or suspected or documented spinal injury. Instructions given to patients on antibiotics include A. Stop antibiotics on disappearance of symptoms. B. Consume antibiotics at convenience. C. Notification of side effects is not required. D. Take medicine as prescribed and complete the course. And the correct answer is D. Take medicine as prescribed and complete the course. If you stop treatment before the antibiotic cycle is over, the remaining bacteria can continue to multiply. If these bacteria become resistant to the antibiotics, they can potentially do even more harm. It may take longer for you to recover from your illness, and your physician may have to prescribe more medication. A nurse checked the pulse of a patient and found the pulse rate is 120 per minute. It is called A. Tachycardia, B. Hyperpyrexia, C. Tachypnea, D. Arrhythmia. And the correct answer is Drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.